So the first piece is simply here you were in 2023, you had $50 million of fees that your existing health plans had paid to you because they didn't meet quality benchmarks. And you were trying to figure out how to use this money. And you approached it in a very different way than I think many payers would have. So, talk a little bit first before we get into the specifics about how you approached how to use that money.
Yes. So the first thing was we didn't actually know how much money it was going to be actually until late into the process. So you can imagine how difficult it is to design something when you don't even really know what the budget is. We had an idea, but the scores from the health plans hadn't come in yet, and so we didn't have a locked in budget. So the first thing I did was try to understand because I was new to covered California at the time. So it was sort of one of these opportunities where you're given amazing tools, but you have a new, fresh lens because you're maybe not entrenched in the institution or past conversations. So the first thing was like, what are my legal parameters? Like, what are the things that are going to get me
Things to start.
sued or that I'm not going to be able to do? And frankly, again, to the earlier conversation, because really we're a startup, all of our council has a startup mentality. So they're like, well, I'm going to give you the parameters, but like I'm going to also tell you where the line is blurry or a little bit more flexible, which was very helpful. And I'm very grateful to them. They were close partners in this work. And then we did a little bit of a brainstorming session where we were like, should we build parks? Like, what should we do that would like that nobody else is doing or that maybe is so far upstream that it would really make a difference to folks? So that was pretty fun because then we had a list of, as you can imagine, dozens and dozens and dozens of things. But then we're like, okay, let's come up with some guiding principles. What are the things that would make us feel like we're making, smart decisions and, things like equity, thinking about not being redundant, that it's really additive, that there is some evidence base for, but it doesn't have to be perfect, right? We'll take that there's sort of like a seedling of an idea from something that was pretty rigorous that maybe we could try to scale because you're an academic. Not most things can't lift and shift. That's just not the reality of implementation and implementation science. So came up with some guiding principles, did really, really extensive literature reviews, didn't see a lot that, the exchange population is very specific. And then we were like, you know what? Let's just ask our enrollees. Like, let's go talk to them. Maybe they'll tell us what we should do, or they'll tell us what they're most struggling with when it comes to some of these quality health indicators and outcomes that we're measuring. Why isn't your diabetes controlled in a way that you want it to be controlled? What happened with your colorectal cancer screening or other preventive care that got in the way of that? And we did the same listening, not just with our enrollees, but we did it with consumer advocates, with the health plans. We started to talk to the physicians, the practitioners, primary care docs who served our members, not general outreach, specific. We know that you're a practice that serves thousands of covered California enrollees. What's happening in your practice that might be getting in the way of this? So we cold called hundreds of covered California enrollees in multiple languages. I did some, I had interns do some, we had other people in my division do some because we had not done this type of work before. And it was so informative that we said, wow, okay, how do we get a little bit more of that voice? And so we sent out a sort of email-based survey, again in multiple languages, but still pretty free form, and had I think we had about 1,000 respondents to that too. So we had a lot of input directly from our enrollees. And that is what shifted what we did. We heard that they were financially struggling, and the quotes were so compelling. It was like any little bit of help would make a difference. Like, I can't pay my rent. I don't have gas money. I can't pay for groceries. I'm trying to hold on to this premium. It was like all of these things. Like, so if you could even take any bit of that, it would be incredibly helpful to us. And then we asked some specific things like, okay, monthly, lump sum, which one? Food or transportation or childcare or this? And so we actually shaped the program based on what we heard from all of these stakeholders.
Was there any story that really stood out to you? I mean, I'm sure there were so many stories, but could you give us some examples of things you heard that were particularly compelling?
Yeah, I'll think the one that sticks with me a lot is some folks in rural communities who said, you know, if I want to eat healthy, I have to drive an hour to the grocery store that actually has produce. And now I'm deciding, do I spend my gas money
Mm.
on that hour long drive or do I eat what I know is less healthy for my family? Think stories like that, where it was like these real trade-offs that we heard that people were making, and sophisticated trade-offs that they were making. A lot of folks were like, no, I've got childcare covered. Well, of course you've got childcare covered. If you have to work, childcare can't be the variable for you. So it was really like, okay, childcare is covered, but the food isn't covered. Like,
Mm.
I'm struggling to make sure that I can get food on the table every month, and it's like I'm cutting it down to the wire. So that, I think, was very compelling to us, which was, you've got folks that are managing their budgets in a very thoughtful way. They know what they should be doing and what they want to be doing and need to be doing, but there just isn't enough money to do it. And so that, I think, also shifted for us, which was, we trust our folks to make the right decision. How do we just give them a little bit of extra breathing room?
Mm. I love that. I think what you said is it's just the financial, not having a cushion also means that any small thing can throw you into a tailspin. So having a little bit more of a cushion is really helpful.